Halloween from RiverBender.com. Now, back to our daily show.
Welcome back to our daily show. I figured, I'm not the biggest Halloween guy out there, but I got to get into this. You got to really live it.
Yeah.
I guess.
I think it's a fun time of the year.
Laurinda, good morning and happy Thursday to you.
Good morning.
How long's it been since you've been in the studio?
I was here in February, Heart Health Month.
Man, it's been fun. It's been a busy year.
It has been.
And how are things at OSF?
Great. We're busy, providing a lot of good cardiology care and keeping people healthy.
Well, and it's really, what I think is really fascinating too, and I wasn't going to tell you or Tim this before you came on, but just the conversations that I hear from folks in the community that are just so much more excited about healthcare in Alton. And you would think that that's a kind of an oxymoron thing to say or something that just doesn't really line up, but they aren't having to drive all the way over in 270 and fight in the war zone that is 70 and all of that. They can get this great care right here in their own backyard.
That's exactly it. And I hear it several times a day, every day.
I bet you
literally, patients will say, I'll order a test. Do I have to go to St. Louis? That's the first question. And when I say no, we can literally do probably 95% of your cardiology care here on this side of the river. It's a huge satisfier. And then I think patients are more compliant.
Yeah.
Because they don't have to take that time from work or fight the traffic. It's overwhelming when you're not familiar with your surroundings.
Well, and you'd know more about this, really than I would, is that whenever you're having those things where you aren't driving to St. Louis, I'm sure it feels like more of a connected atmosphere for that patient, too.
Yes.
Really cool.
Yeah, we call ourselves a family.
Yeah.
And it really is that family feeling. And I think that, patients feel that.
Really cool. Well, one thing that I think is so important to talk about, and Tim Dittman's the one who provided me this topic, and it's just brilliant, is hunters and heart health. And there is times that I've had conversations with folks that were, hunting with maybe not even an older relative, just with, somebody that's middle age, and, they were having some, heart issues or maybe symptoms of something happening, and they spent their whole day hunting, and they didn't realize that they were having a medical event going on. And that's scary.
Yes, it is. And so a few years back, the American Heart Association kind of brought a campaign slogan, heart health for hunters. Mm-hmm. And it's really, you think about hunting, there's a lot of stress that can be on the heart for the big day, all right? There's the excitement, the increased heart rate, the physical activity. And so I can tell you from being in cardiology for a lot of years, there wasn't a hunting season that went by that someone wasn't brought in with an emergent heart attack. And it's also strokes, right? So cardiovascular health, it's the heart, it's the brain, it's the legs. And so really was to bring awareness that, hey, don't wait until the big day to do that excessive physical activity, because that's actually more stressful than a stress test that we would do in the hospital.
Are you serious?
Yes.
That's very fascinating. And so before we dive into any other part of that, what do you recommend for somebody that maybe isn't as active as they need to be, and they're ready for hunting season? And, obviously some of it's already started now, but
right.
For the next one's coming up, if maybe they felt a little bit too tired, and sluggish getting through that, how can they prepare in a way that wouldn't really alter their lifestyle, because these folks probably don't want to go to the gym, 2 hours a day?
Right. So it's starting, 6, 8, optimally up to 12 weeks before the big hunt. But start increasing overall physical activity. So start taking the stairs, maybe parking further away, getting more steps in, increasing your physical activity, trying to get some of that aerobic activity, getting your heart rate up. And then that as a person, you would recognize, boy, I'm starting to have maybe quite a bit of shortness of breath that I didn't have last year, significant fatigue that I didn't have last year, maybe some other symptoms, chest heaviness, which would really alert you to be seen right away. But start with that physical activity. You wouldn't just go out and run a 5K if you're a couch potato, right? You work up to it. It's the same philosophy when you're preparing for a big hike, a big hunt.
Well, and going into that too, you were talking about some of those, elevations and what could cause your heart to beat a little bit faster, or maybe getting a little bit of distress. But what about the drinking component too? Because we all know the hunters in our life,
Right.
and sometimes they, might bring something in there with them to kind of sip on, or maybe even drink through with a couple of buddies. What does that do to the heart on top of, the stress that hunt could bring? Because I know just from, just pro wrestling that the big thing was you don't drink when you're working out, or don't work out when you're drunk.
Right. So, part of the recommendations that we make, it's the same thing. You wouldn't go and run, if you're a half marathon runner, a marathon runner, you wouldn't drink heavily the night before. You wouldn't eat a giant breakfast the morning of, because that puts more stress on the heart and the body. So when you go out hunting and the night before when you're with your buddies, and you might have risk factors such as high blood pressure, high cholesterol, diabetes, and then putting stress on it from drinking a few too many drinks, and then getting up that morning and having a giant breakfast where you're asking even more from your body, and then trudging out into the woods, maybe getting a deer, needing to drag it back. All of those things are adding significant stress on the heart. And
is it one of those things where, when people just think of hunting as a term, they aren't really thinking about the activity level of it? Is that really the disconnect here?
Yeah, I think so. They think that, it's a few days out of the year.
Right.
But maybe they've been so sedentary over the last 6 to 7 months that, compounded by risk factors, they haven't really been in tune with, is there something different going on in my body?
What about the sleep pattern being altered?
Right. So getting up earlier, definitely we know that altering sleep patterns, we're going to have a time change.
I remember.
Yeah. Yes, you do. You do. We're going to have a time change again here in a few weeks. And then we'll, we have it twice a year still. And
I'm fighting.
I'm with you. We know that changing our circadian rhythm puts more stress on the body as well.
And that's something that, you add all those things up and it does make sense. And before we, dive into this a little bit further too, is the people that are around them, because, if we're at a restaurant and we have a heart episode, there's a lot better likelihood that EMS is going to get there within a certain amount of time.
Correct.
But if you're in the middle of the woods in Calhoun County, or you're in the middle of the woods in southeast Missouri or in Branson hunting, they aren't going to get there that quick. And so what can we do with, maybe as we're going in a group, is there some device we could bring that's portable, or is there some techniques that we could do if one of our hunting buddies, falls ill?
Right. So, knowing the risk factors, knowing signs and symptoms first and foremost, knowing that if you're having a chest heaviness, a burning in your chest, increased shortness of breath, you're just overall not feeling well, don't push it. Ask for help. Don't be a hero. Don't be like, I'm going to drag this deer by myself regardless.
Right. That's a good point.
If cell phones work, have a way to contact a buddy. Don't hunt alone. Let people know where you are. Travel with baby aspirin. Okay, so even if you don't have a history of heart disease, the first thing EMS does when someone's having a heart event is have them take 4 chewable baby aspirins, right? It thins the blood.
Okay.
So if there's clotting, if there's a heart attack going on, thinning that blood is helpful. So just traveling with baby aspirin.
Wow.
If you have a history of heart disease and you've been prescribed nitroglycerin tablets in the past, make sure you take them with you. Popping them under the tongue, it dilates the blood vessels, gets more oxygenated blood supply, can decrease the amount of the event that's happening.
So when you're no different than when you're preparing all your gear.
Correct.
Prepare some other thing. Prepare that first aid kit. Well, and the thing is too, you brought up harvesting, and grabbing that deer or grabbing it, no matter what it is. It could be a turkey, a boar, you name it. Is that where you see the biggest risk when it comes to those heart episodes or those heart attacks and strokes?
Yeah, I've seen it with that, but I think just in general,
really?
too.
Okay.
The getting up early, the walking out into the woods, climbing a tree stand if they do. Sometimes they do drives where they're walking a lot further up and down hills. And to the point of being out of town. If you're from Alton, but you go to Branson, knowing where the local heart hospital is, right? So if you do have an event and you're with a partner or a buddy, so they know where to take you, right? Because the worst thing is you're in not familiar surroundings, and then, okay, where do we go? Like, I'm not feeling well, or where, how do we get help right away?
I've been wanting to ask this question for a while, and this is the perfect time to do it. I keep seeing this commercial on the news, and it's about this darn card you put your thumbs on, and it tells you your EKG, or and smartwatches have those too. Is new technology reliable enough to at least give us a little bit of information on maybe, hey, if somebody does have that watch, slap it on your buddy's wrist there for a second and see if his blood or his heart rate's out of control. Do those help?
Yeah, so they're quite accurate. I've had several patients that I have seen over the years that have not so much for a heart attack, but for a rapid heart rate or an irregular rapid heart rate. Even my own watch recently said your resting heart rate's higher than it used to be, and I'm like, oh no.
Mine keeps saying it's too low. I'm like, I'm not dead yet,
But I think that all of the tools that we have are helpful, and anything that can save just one person from having a major event.
And what are, some of those risk factors, too, just to go over them again? Because there are quite a few to take into account.
So if you smoke, that's a risk factor. So that first and foremost. But going down the line, high blood pressure. If you have a history of high blood pressure, high cholesterol, diabetes, inactive lifestyle, maybe heavy alcohol use, obesity. But for a lot of people, they don't even know they have high blood pressure.
Right.
It's termed the silent killer. I can't tell you how many times I see patients and it's like, I never had high blood pressure before. Well, when was the last time you had it checked? Well, it was 6 years ago. So, that's why it's important if you are going to, hunt and you're going to be more physically active than you have been, then getting a checkup, just getting some simple blood work, knowing if your cholesterol's high. Are you now diabetic? We all change. We're not typically, born with diabetes and high cholesterol. We acquire them.
This is really fascinating. Well, and, is like an AED out of the question? Let's say, because there are folks that really have to, hunting is what they're doing this year. And we all know that sometimes when folks are maybe a little bit weaker, maybe they were sick, could you bring one of those devices? I mean, are they affordable enough? I mean, because I don't know anything about, that type of resuscitating device. But to me, if they're portable, that could work.
Yeah, I mean, I'm not so sure how affordable, to be honest.
I don't know
I don't
either.
even know the answer to that either. Yeah. But I would think it would be reasonable in large hunting camps. You know, would that become more of a standard of practice? I could see how, like you said, you have a lot of more middle-aged. You used to hunt and go running up a hill in your 20s, but now you're in your 40s, 50s,
or
60s.
even 60s,
And you have all of these risk factors over the last several decades. And you go to a hunting camp where maybe there's quite a few people.
Actually, it's not too bad. About $400, and then $1,200 for a Phillips heart song.
Okay.
But to me, I'm one of those people that I have to think about everything that could go, especially if I'm leaving my area, because like you just said, you don't know where the hospital is or some of those things. And I always try to prepare for DEFCON 5, even if it's only like not even DEFCON -1. That's just me personally. Right. Really interesting.
And I think that's kind of part of the campaign. We think about hunter safety, and it's all of the things like wear the appropriate, orange and make sure you're visible, and stray bullets and all the things that we can do. But really, you're more at risk of a cardiovascular event more than a stray bullet. So I think that was why the American Heart wanted to bring awareness.
That's a really good point, though. I mean, really great point. So you also just passed the heart failure certification?
Yeah. So the Heart Failure Society has a couple of years ago came out with an exam for clinicians such as nurse practitioners, physician assistants, ER doctors, pharmacists, even cardiologists. If you spend a lot of your practice taking care of heart failure patients, it was really a way to kind of show that you have, advanced knowledge of taking care of patients with heart failure.
Really interesting. And that's good to know for folks that are coming in, just to know, hey, the person I'm talking to really does know their stuff.
Right.
What are some of the other things that you see just from the office, from folks coming in, heart-related issues? Or I kind of want to piggyback on a question for me personally. I keep talking to Randy about this, and I've talked to other folks, and we've talked about it. Are young people and heart illness still kind of happening? Is that still prevalent in this community?
Yes, absolutely.
Wow,
so,
amazing.
It's a lot of changes in the American diet over the last several decades.
Is it these things?
Increased, that doesn't help. Fast food comes at a cost, right? And more sedentary lifestyles. A few years ago, they came out with sitting is the new smoking. So you couple that with the American diet and activity, people developing diabetes at a younger age. I deal with a lot of patients who say they quit smoking, but they're vaping.
Is that still smoking?
It is.
Okay,
yes,
thank you. I'm so tired of hearing that because I've been really fighting this to quit smoking. I've been trying so hard, though. I'm really fighting the good fight. I'm not running right now, but I still am participating and still an active combatant,
Right.
But one day I'm sitting out there and I was getting ready to go bum a cig. I saw somebody smoke. I'm like, I can go ask him for a cigarette. I said, no, don't do it. Well, then this guy goes, I quit smoking, so this vape's been really helpful for me. I just, use this 3% nicotine, and I'm like, you're still smoking it.
Right.
I mean,
you still have the effects of nicotine. Right. I tell people all the time, the lungs weren't made to inhale things other than clean air.
Well, and honestly, it's a good thing to kind of realize because, I didn't realize how dangerous some of that, vaping and how addictive it can be. And for young people too, does mental health go into that heart episode ever? Because, you always hear someone tell the old thing was calm down before you give yourself, a heart attack. Is that real?
Well, definitely stress. So we do see, stress plays a negative part on our body. It can, accelerate, heart problems, increase the pulse, increase, how our body reacts, internally as far as certain levels of cortisone, which can have a negative effect on the body.
Absolutely. Well, and then, I kind of went on a tangent with younger people here for a second, but, in general, what are some of the things that you can educate us on just from what you're seeing currently the last couple of months since I talked to you, in the office?
Yeah, it's still a lot of the basics, know your risk factors, get routine checkups. If you're having symptoms, don't ignore them. Every week, someone coming into the hospital where they've had symptoms for days, and the more you put off the symptoms, the more you're at risk for having a major event where you could, one, the worst case scenario, you pass away, or two, it's having long-term effects where there's heart muscle damage and it really, that's where the heart failure comes in, and managing that. We really... early recognition, prevention, number one, if not early recognition. And you're just going to get that by if you see a doctor, once, twice a year. And then listen to us. So many times it's patients, I don't like to take pills. Well, nobody likes to take pills.
Right.
But if you have diabetes, you're going to have to manage it. And if you really, really, really are strict with diet and exercise, you can turn some of these things around. But as we get older, having to take a couple of pills to help manage blood pressure and cholesterol is going to go a long way.
Absolutely. And, you just hit on something that's kind of fascinating to me, too. How many folks go in, and, it's hard to ballpark this, that don't have a primary care provider? Because to me, that's a life I've never experienced.
Right. So a lot of referrals we do get from the emergency room.
Wow.
Right. There's still a lot of people that get their care from the emergency room.
Wow.
And so, really, if we could I get referrals every sometimes every day, but definitely every week with this patient keeps coming in, they need to be established. I will see them, but then at my visit in the clinic, really we work to get them a primary care provider.
And see, that's really good to know, too. I'm glad that we brought this up because I didn't know that you would do that for folks because they need sometimes to have that, advocate role to fulfill to get them that primary care provider, too.
Yes.
Really very important stuff. Well, and so, with all this being said, this is a very serious thing because there's so many times where, you see the stories on the news and everyone always thinks, well, this won't happen to me, but you just never know. So preparedness is always the best case scenario, right?
Correct.
Mm-hmm. And now how can we get an appointment with you or anybody at OSF, whenever we're even maybe just wanting to get looked at? Because for just talking about that primary care and not getting your blood pressure taken for a couple of years,
right?
I'm sure that happens quite a bit.
So we get referrals every day from primary care providers, and it's from everything. It's people who are actively having like new chest pain symptoms as of late, to I have a family history and I want to establish and make sure I'm doing everything right. So it's from very early preventative cardiology medicine all the way to people with advanced heart failure that I actually have referred to St. Louis for evaluation for heart transplant. So we do everything from very early preventative medicine all the way to that's where the heart failure certification comes in, you know, and everything in between.
Before I let you go, are there things that you all can see in your office that our primary care provider might not be able to detect in a routine checkup?
Well, I think, you know, when you see a specialist, that's all we do.
Right.
You know, so, I mean, patients will want to talk to me about orthopedics or endocrinology, and I'm like, I can't answer that. But in cardiology, we know we will do more advanced testing for maybe preventative or uncovering maybe hereditary types of cholesterol disease versus hereditary types of heart failure. And then, you know, blockages and people who might need surgery or stents in the cath lab. Because,
I mean, my kind of follow-up with that is, have you ever had, I'm sure you've had patients that go, well, I get, you know, checked once or twice a year and everything's been fine. This just happened out of nowhere. And I didn't know if there was a way that you could have maybe detected that a little bit earlier.
Yeah, I think we're a little more aggressive in cardiology now as it comes to diabetes, high blood pressure, and cholesterol. You know, the goals that maybe are set by the primary care provider, you know, are good in primary care and maybe early prevention. But as patients get older and have other risk factors, our goals change. So we really want lower blood pressures. We really want much lower cholesterol levels. We really want to see diabetes tightly controlled, and then really, you know, increasing overall activity, exercise, et cetera.
Well, and just awareness too, because you don't know until you know. And if you can keep informing people and really just, you know, letting them, you know, because it's amazing to me how simple it starts. You know, how simple the process can be to really start bettering your overall health. And a little goes a long way.
Right.
Man, this is cool. I thank you so much for stopping by, because what I learned today was, I hope you guys did too at home. But if you're a hunter out there, or you know the hunters in your life, it might be something to talk about, or maybe even slip a bottle of baby aspirin in their jacket pocket, just in case.
Right.
Laurinda, thank you so much, and really always, really exciting conversations from OSF, because it brings us insights that we really don't get unless we go into the doctor's office and have this conversation.
Right.
We'll take a quick break at 9:42. Tim, thank you so much for setting this one up, and we'll be back with more Daily Show right after this in downtown Alton.